I am largely recovered from the outcome of the NCAA basketball tournament, but I do occasionally cry for no reason, apparently, but that you can probably guess. So, I got a clicker. All right. So, I'm actually really excited for this conference. This is something that I think we've really needed for a long time, and I think it has a really great potential to become a very significant organization for the development of telehealth going forward. I think that national collaboration is really a huge key to accomplishing what everybody in this room, I think, wants to accomplish, and this is a really good start to that. So I'm going to talk a little bit about our Pediatric Telehealth Guidelines development process, which has been going on for a good 3 years or so now, and has been quite the experience on a number of levels. The really unique thing, I think, about the pediatric guidelines compared to a lot of the other guidelines that have been developed through the ATA, except for the core operational principles that were developed some time ago, is that they're incredibly broad. Saying that we're going to write guidelines for pediatric telehealth is like saying we're going to write guidelines for telehealth, which is really, when you get to it, saying we're going to write guidelines for the practice of medicine. It's because the ultimate telehealth is telehealth that you don't realize is there, right? And so telehealth is applicable to everything. And pediatric telehealth is applicable to every aspect of pediatric medicine. So this is just some of the examples of the ways that telehealth is being applied in the pediatric realm. And why this is so important is because the process writing these guidelines, we very quickly realized that we weren't going to be talking about individual programs, individual conditions. We were talking about the broad practice of telehealth as it pertains to pediatrics, and what are the specific things you really need to think about from a general pediatrics approach that can be broadly applied to a lot of different pediatric telehealth practices. So this process was started through the ATA Guidelines Committee, which is headed up by Elizabeth. And we've been working with a number of different organizations to get endorsements. We have the support of the AAFP, of the Nurse Practitioners Association, the American Association for Respiratory Care, and we were working on the AAP. That is the really interesting part. So our work group consists of experts from across the country, and not just academic medical center providers, but folks that provide school-based telehealth and outpatient, inpatient, multi-subspecialty services. Also, it includes industry leaders, so a variety of telehealth practices. And our goal, really, was to just establish a foundation for what does responsible pediatric telehealth mean. And when you look across the country at what's keeping people from adopting telehealth, a lot of it is uncertainty. Some of them don't know what it is. Some of them think that it's one particular thing that they don't really like. Others think there's no research, and there's not a lot of research. There's a lot of misconceptions about telehealth, and there's certainly not a lot of people out there that really understand everything that telehealth can do unless they're actually practicing telehealth. So we wanted to decrease that uncertainty, and we wanted to provide some backing to those attempting to curtail irresponsible practices, which do exist. And we know that and I'm not singling out any organization or anything in particular, but there are people that try to make a profit off of this, and some of them do it more blatantly than others, and some of them have more of a patient focus. And we wanted to say, for pediatrics, you need to adhere to these guidelines to at least ensure safety and responsible practice. And really, while we're not establishing guidelines for clinical practice, for any specific clinical practice, we wanted to provide the framework upon which to build specific clinical practice guidelines. This is our illustrious group, which includes a couple people in this room and people from across the country, including Hawaii, Texas, everywhere. This is the only known picture of the group together. As you might expect with the telehealth group, we don't tend to be in the same location very often. So, as I mentioned, we're working with multiple organizations, and we've got the sign off on the first three there. The AAP is a challenge because the AAP is a fairly conservative organization, kind of known for being slow in the guidelines development process, and so it has been a big process. And we've talked to 15 different sections within the AAP. Never knew how many councils and sections and whatever, this, that, and the other there are in the AAP, and so you started talking to them all. And we've made a lot of progress. And actually, that interaction has made the guidelines really significantly better. And I will say that without hesitation. Getting the input from so many really passionate providers has made the guidelines infinitely better. Now, why are we spending so much time on this? Because pediatric guidelines endorsed by the AAP are far more impactful than pediatric guidelines created by the ATA, not endorsed by the AAP. Because the ATA is a non-clinical organization, right? And the AAP and the ATA have been at odds a little bit. The AAP released right as we were getting into the process of this guidelines creation. The AAP released their technical report, which was authored primarily by one of the members of our work group, and the ATA immediately responded that it was short-sighted and what were some of the other colorful words that were used, but the ATA didn't like them. And the AAP, looks at the ATA and says, well, you're just trying to say telehealth for telehealth, expand telehealth for by whatever means necessary. So these are the core issues that we really were wanting to address with the guidelines. And a lot of this is in discussion with the AAP, but a lot of this is really important. We wanted to strengthen the patient-centered medical home. That's really the key thing. And that's where some would say that is one of the differentiating factors between the more responsible practice of telehealth and maybe the more entrepreneurial practice of telehealth. We wanted to address how those entrepreneurial things may work to provide better quality of care, and then obviously ensure privacy and confidentiality. Emphasize the importance of appropriate examination and testing. This is a really big thing, and this is where you get into the specific diagnoses that everybody was very gung-ho about. You gotta say that if you're gonna diagnose acute otitis media, you gotta look in the ear. We're not gonna sign off on any guidelines that don't say that you have to look in the ear if you're gonna diagnose acute otitis media, right? That's not actually what, we've gotten past that, but that was kind of the starting point. And then we had to make sure that they were broadly applicable across multiple specialties and conditions and encompass this wide array of delivery methods. Because the tendency of the folks that fear telemedicine is to focus on the direct-to-consumer model. And if they do that, you're going to create guidelines that may serve you well for ensuring appropriate practice in that direct-to-consumer model, but then you didn't even think about the fact that you just totally destroyed my pediatric critical care program because you put in requirements that I can't possibly meet, right? Because I'm dealing with an emergency situation, right? You may totally mess up a school-based telehealth program. You have to consider every single delivery method, which is what added to a lot of the complexity. And then the other thing is we're not reinventing the wheel. We really just wanted to build on the guidelines that have already been established. So what about supporting the patient-centered medical home? The key thing is we want to avoid fragmentation and duplication of care. So there are multiple statements within the guidelines, which, by the way, are not called guidelines also per the AAP. They're called operating procedures. So I'm going to try to go back to call them operating procedures here. So states that you must ensure a means of communication with primary care providers, meeting that same standard as you would for in-person visits. And this is kind of the key thing, and this has been referenced here already today. I've heard, you don't hold telehealth to a higher standard than what you hold other in-person providers to. But you do hold them to the same standard, and that's the key, right? You're not lowering the standard, but you're not raising it either, and that can be tricky. So we also wanted to encourage the involvement of primary care providers in telehealth services. So that we stated that telehealth can be provided through the patient-centered medical home or as a complement to it. And we want to have a standard mechanism in place for sharing documentation with the patient-centered medical home and also follow up and communicate any results. Now, as far as entrepreneurial telehealth, there is growing concern within the academic community that companies that are looking to make a profit are going to damage the patient-centered medical home and put community providers at risk. Teladoc has successfully sued the Texas State Medical Board, which I'm sure everybody in here knows, but that's a key issue with regards to the ATA and AAP endorsement. The Teladoc literally said, their argument is, this is a bunch of providers telling us how we can practice. They are exerting monopoly powers, and they can't do that. And the Federal Trade Commission agreed, and they lost, right? And so if the AAP tries to release their own guidelines that don't include or involve the ATA, everybody just ignore them, right? These companies, they don't have to pay any attention. It's the American Academy of Pediatrics. There's a bunch of pediatric providers. Of course they're going to say we can't practice the way that we want to practice because it's putting their practice at risk. So they just ignore them. That's why the AAP has to coordinate this. So what constitutes an appropriate examination? That was one of the big things. And how do we address that without addressing specific diagnoses? That's the tricky part. So you have to make sure you have the appropriate equipment, size, comfort, accuracy, validity, and talk about what is just a general appropriate examination. We didn't want to get into specific diagnosis because it's too broad a scope, and also anything that you don't reference becomes fair game, right? If you talk about sinusitis, acute otitis media, and urinary tract infections, then there's 50 other diagnoses that they just, they're fine with whatever we do there. So, I have like 3 minutes, but I'm still going to read this whole thing. Because this is probably really two of the key things within the guidelines, and this gets at that appropriateness and that adhering to the standard of care, right? So, providers shall comply with relevant standards for each clinical situation as determined by state medical boards and regulatory agencies in both the state where the provider is located and the state where the patient is located, just as they would for an in-person encounter. The provider shall have enough evidence from the history, physical exam, and/or an established prior patient relationship, key point, to make an appropriate clinical decision. If the provider is unable to comply with the standard of care for diagnosis and management in any clinical situation due to technical limitations or provider comfort level, the provider shall refer the patient for additional evaluation where they can receive the appropriate standard of care, whether that is an in-person encounter or a telehealth encounter that is not subject to those specific limitations. Okay? And then specifically with regards to examination, telehealth services shall follow relevant standards for the diagnosis and management of any condition addressed as determined by state medical boards and regulatory agencies in both the state where the provider is located and the state where the patient is located. The standards are the same for telehealth services as for in-person services. In cases where the standard of care includes the use of specific examination devices or tests for diagnosis, ear exam, urinalysis, etc., strep test, then these devices and tests shall either be utilized in the telehealth encounter or the provider shall refer the patient to a provider or location with access to the necessary examination or testing devices so the patient can be appropriately evaluated prior to the prescription of medications or other treatment for the management of that condition. So now we establish this, and the job becomes, all right, AAP endorsed these guidelines, or operating procedures, and now it's your job, because you're the clinical organization, to say, all right, this is the standard of care, right? Now you have all the backing you need to say, we're going to build on these guidelines that were produced by the ATA. Therefore, these industry organizations can't just say that we're ignoring them. But these guidelines say you have to adhere to the standard of care. And guess who's the people who determine the standard of care? So we are going to build on these guidelines to show you what are the standards for particular diagnoses. And this is how we envision this working. We actually have got the beginnings of a collaboration between the ATA and the AAP to move forward after this core operating procedures guidelines with a collaborative development effort for specific diagnoses, so that we will evaluate best practices looking at evidence that already exists. If that evidence exists, we incorporate it into condition-specific guidance. If it doesn't exist, that's where the research comes in. So then we incorporate things like Sprout, which is a wonderful segue into our next speaker. So this is, what we really want is to have all of this integrated into a collaborative effort to figure out how do we do this best. And in order to do that, we need to have guided, focused, collaborative research. And with that, I think I will then introduce John.